At ASCO 2020, there was two very interesting studies that were presented in oral presentation on ctDNA from metastatic breast cancer patients, ER positive. The first one is an analysis of the PADA-1 study looking at the prognostic value of ESR1 mutation at diagnosis. And the second one is a pooled ctDNA analysis of the MONALEESA trial looking at DNA abnormalities responsible for sensitivity or resistance to ribociclib. At ASCO 2020, we did a very nice presentation of the PADA-1 study. The PADA-1 study is a large trial in first-line metastatic setting for patients with ER positive, HER2 negative breast cancer treated with palbociclib and letrozole. The primary investigator is François-Clément Bidard, and it's done within our group, the Unicancer breast group in France. So this is a very important study because it is the first one that will assess cfDNA, cell-free DNA, at inclusion and every 2 months. And we are looking in this DNA the mutation of ESR1. So we are looking at prevalence of apparition of ESR1 mutation during the treatment. And the primary endpoint of the study is to do a randomization of the patient between going on with letrozole or going on with fulvestrant after the appearance of the ESR1 mutation. And we hope that to prolong PFS by changing the hormonotherapy backbone of the patients. So that is the primary endpoint. We don't have enough events to assess it for the moment. The presentation at ASCO 2020 was the prevalence of ESR1 mutation at inclusion within the blood. And we have found that 3.2% of the patients did have some ESR1 mutation at inclusion, despite they did not start their treatment in the metastatic setting. The proportion of patients that did receive aromatase inhibitor in the adjuvant setting had a higher proportion of ESR1 mutation at inclusion. It was 7.1%. So this subgroup with mutation at inclusion had a worse prognosis than the ones that did not have it. Their PFS was 11 months in median versus 26 months for the patient without this mutation. So obviously, it's a prognostic. It's a worst predictive factor for evolution, but it's not that bad because 11 months is the time to progression that you can expect with letrozole alone in this population. So despite the fact that they have this resistant mutation at inclusion, they still benefit for most of them from the combination of letrozole plus palbociclib. Those are preliminary results that are of high interest for future treatment decisions, and we are waiting eagerly for the last result of the primary endpoint of randomization between fulvestrant and letrozole at the emergence of mutations. During ASCO 2020, there was a very nice study that was presented by Fabrice André. That is a very large translational study from the MONALEESA studies. So the three MONALEESA studies, 1, 2, and 3, that were pooled together. As you know, those studies have assessed the efficacy of ribociclib in top of hormone therapy for patients with metastatic breast cancer, ER positive. And so in these studies, there was some collection of plasma, and they have used those collections to do a very large translational study on cell-free DNA, on ctDNA, on 1,500 patients. So it's a huge endeavor. It's a very important study. That's the biggest study with regard of this for this kind of analysis that was published in this setting. And so they have found a lot of abnormalities in the gene of those patients, of the tumoral genes. As usual, PIK3CA and TP53 was the most often abnormal gene, but they have no consequences on the treatment. Other ones had consequences. Some of them increased the likeliness of efficacy of ribociclib. Others were predictive of no response to ribociclib. Among the ones that were more associated with a better responses. We had FSR2, that was a substrate of EGFR. There was MDM2 that are most often co-amplified with FSR2. So those two genes increase the sensitivity of the patients to ribociclib, and it could be of importance for selecting patients afterward. Most importantly, those genes are bad prognosis with regard to hormone therapy. So to know that it's bad prognosis in one hand and more sensitivity to ribociclib on the other hand could be important for future treatment strategies. And on the other hand, they have found genes that abnormalities on those genes predicted no response to ribociclib, and most particularly CHD4, ATM, and CDKN2A. When you have some abnormalities on these genes, deletion or mostly deletions, then you have less sensitivity to ribociclib. So it was really a big study of high interest, and it's very early to know what consequence we'll have from those different find, but it may be important for future treatment development and strategy.